Hi, I'm Ray Barrett, the CEO of the Telehealth Certification Institute, and I'm going to be talking about phones, texting, and fax. So, healthcare providers, we need a solution for phone, for texting, and for fax. And there's a lot of things to consider when doing that. One is privacy law. The other one is the user experience for the clinicians, the staff, but also for patients and clients. And so the solution needs to be really convenient. Otherwise, people are not going to use it, right? Very user friendly. And it also has to be all underneath the wheelhouse, the control of the provider for security and privacy reasons. So to discuss this topic, I have Pankaj Gupta with us, and he is the founder of IPlum. And we've begun to really like IPlum a lot because they provide a great solution for all of those things, phone, fax, and texting, in a way where it's all integrated under the provider's control. So Pankaj, thank you very much for joining us today.
Thank you for inviting me, Ray.
Yeah, excellent. So if you can begin just by sharing with us, why is it that you started IPlum in the first place? What were the needs that you were seeing out in the healthcare community?
Great. I'm a technologist, and my goal is how to find the inefficiencies in a market segment and how to create a good solution to address that. So we saw two things happening in the healthcare sector with respect to the communication. The first is the physicians, they care about privacy while using their mobile phone. And secondly, there's a security risk with personal contacts and data mixed up with patient information. So we wanted to address these two requirements with a solution which is both forward-looking, at the same time, it's affordable for large market adoption. As more physicians are working longer hours, they need to be able to use their mobile phone in a very easily affordable way and make it sure it does all the protections required for HIPAA compliance. So the question came up, okay, why not just carry two phones? Okay, the answer is no. It will solve the privacy problem for the healthcare professional. Of course, it's inconvenient to carry two phones, but it will not solve the client data security issue on the second phone as required by HIPAA compliance. So that led us to create IPlum, which helps to resolve these issues. Now, IPlum provides a secure business phone line on existing phone by keeping the business and personal data isolated. There's no change in carrier required. It is end-to-end HIPAA compliant. We provide calling features, secure texting, and secure fax.
Excellent. Yeah, and I know that if the healthcare provider is not providing a solution like this to their clinicians and their staff, the clinicians and staff, they're going to do it like they're going to find alternatives that are not secure. So I've worked in a lot of large healthcare, some large healthcare organizations, and clinicians and staff, they were using standard old texting. They were using their own personal mobile phone cell numbers, right? Which creates a lot of problem. They were storing, clients and patients' contact information on their own personal services that they get from their own cellular service. So all of those things create a lot of problems in terms of privacy and security and being compliant with privacy law. So yeah, it's really important that we provide a solution. And I really like the solution that you provide. One of the obstacles that we've been finding providing consulting for healthcare organizations around telehealth is the texting, because clients, patients, they love the text. That's how they really enjoy connecting with people. It's just really easy for them. But standard old texting, right? SMS texting, you're not able to encrypt it, right? Unless you use an app. But then the provider of the apps can have access to that data. So it needs to be provided by a provider that protects that information, like healthcare information. But a lot of the providers out there, you can't provide that texting app without a fee to the patient or client. So that's one of the things I really like about IPlum. The organization gets an IPlum account. They can dispense phone numbers, accounts to all of the staff. And then all clients and patients can use the IPlum app to securely text with their providers and clinicians. So it really increases that patient engagement and connection, which we know from research has incredible benefits to it. Excellent. And so what are some of the challenges that you've seen with healthcare systems using phone lines, fax, and texting?
Sure. And in Ray, from your experience, I can trust that since you guys provide training to a lot of healthcare professionals. I mean, you guys have a vast experience on knowing what the pitfalls in the technologies are and how they can be addressed and what's the best market products to circumvent those issues. So I really appreciate your feedback and some of the insights. Having you have seen it all, I would say, with working with your client base. On some of the basically what I see is healthcare providers, they need their own privacy as well as security for their client data. Now, this is across all three sort of components. It's calling, it's fax, it's texting. Because there is always sensitive electronic protected health information which needs to be secure. And for phone calls and voicemail, they have client, we call it EPHI data, which needs to be protected. Texting needs a special end-to-end mechanism to secure the data. Now, IPlum, as you mentioned, provides a free app to patients where they can communicate with their healthcare professional in a secure channel. And for fax transfer, it has to be encrypted, and which is also, we provided here at IPlum. Now, some of the biggest challenges we face is how we can provide all the security and at the same time provide a user interface which is simple, which can be adopted, because you don't want to make it too complicated and then no one wants to use it, right? That's so our goal is to make it seamless for our clients who need security but don't want to be bogged down by its complexity. You don't want security to be the upfront. Security needs to stay in the back end, just like on the iPhone. It has a lot of cool features, but it still requires provides the best user interface. So you're not bogged down by the minutiae of it. And IPlum, for example, we got great reviews due to our simplicity. We have, for example, 4.8 out of 5 in the App Store rating. And it's very difficult to get that kind of high rating for a paid solution, which our clinicians and providers they get. And Apple featured us a couple of years ago as one of the best in the business apps category, which I'm really proud of, and which has been possible due to a lot of good feedback provided by the providers who use our product.
Excellent. Yeah. And and another challenge is equity in terms of, everyone being able to get access to quality healthcare. So, people may not have access to video conferencing technology, or they might not be able to go into a facility for treatment, but people have cell phones, right? And they're using texting. So being able to provide services over the phone and through text is really helpful. But then another challenge is, well, what can you use that texting for? If it's just sending messages back and forth, it could be limited. So I really like how the IPlum app, the texting function also allows the ability for file transfer, for taking images off the cell phone, and for audio recordings to be sent. That's really helpful. Some people, they like to communicate by just leaving a message, right? Just leaving a voicemail rather than typing something up, right? So having that capability is really helpful. And then another thing is just simply say you need to verify the identity of a patient or client, where they can easily, using their cell phone, just take a picture of their photo ID and message it through the texting app, through being able to upload that image. And then some of the privacy and security concerns is the data is PHI. So those text messages going back and forth, they need to be retained, right? The voicemails should be retained, especially if they're converted into text, the fax. So having a cloud-based service which protects and retains that data is really helpful. And then being able to push policies onto the end users for security. So another thing I really like about IPlum is that the provider can ensure certain password policies on the end users. They can enforce that their workforce uses two-factor authentication, which is really important because devices are easily stolen and lost, right? So if someone got access to a clinician's cell phone, even if they're able to get into the cell phone, it doesn't mean they're able to get into the content on IPlum because there's a separate authentication along with the two-factor authentication. So all of these things I find really helpful. So I'm really glad with what you guys are doing. And another challenge that I find organizations have all the time is cost, right? So sometimes we'll have a solution for them like, oh my goodness, like now we're like doubling our cost here. So keeping the cost low, I really like how you've been able to keep the cost low for providers and have it manageable. And from what I understand, that could be scaled, right? So especially in terms of like the cloud storage, which seems very reasonably priced, makes it doable for organizations.
Absolutely. I think this is one of the key thing in our solution is, you can build the best product in the world, but if it's so expensive, then you're not going to have a lot of adoption of the product.
Mm-hmm.
A lot of these businesses, they have other costs going on, and we don't want to burden them with another communication cost. Communication is an important thing, but we wanted to bring the cost for a HIPAA compliant solution like a regular, add-on line. And that's what we have tried to achieve. So we made it really cost effective. You can get the best technology with encryption, with all the protection, and still, I call it less than a lunch per month.
Mm-hmm.
So, it's that inexpensive. And the reason we are able to do that is because of our technology. We have built the technology, which is very scalable. We have done it all in-house, so we don't have to pay to a lot of third-party providers for some of the technology. So we can do it all in-house and do it on a very inexpensive way. And then there is a lot of automation in the product. So we don't need to touch hands. We don't need a lot of manual interventions. So that allows us to do a seamless, first of all, it works really well for the client because they can do self-service and it's fast. Anything you provision is provisioned right there. You don't need, someone in our team to go out and provision lines and then activate them and all that stuff. That's all, old way of doing it. So by making automation, very high level of automation, we can reduce the cost and make it seamless for our client for end-to-end provision. So those are the things which helped us in passing our low cost to our subscriber, and they really love it.
Yeah, and another feature I like is the phone calls can be made either using internet data, Wi-Fi, or the cellular service. Is that right?
That's another technology we have done in-house. So you can use data, internet data for making and receiving calls. But then through our proprietary technology, we can also send the calls over the voice network on your existing cell phone voice network without compromising your caller ID. So its caller ID will still show your IPlum number for making and receiving calls, but the calls will go over the carrier voice network, making them highly reliable. We call in telecommunications, it's called 5 nines. 99.999 reliability, so which is very high reliability, and at the same time, your call quality is the best. So you get the same carrier level call quality on your second line, which you use for business purposes.
Yeah, and also the client or patient contacts are put on the IPlum contacts list, which
Right.
is siloed from the personal contacts on a mobile device. So you know who's calling, you're able to pull up, a patient or client's data in terms of calls, voicemails, texts, and so forth, according to that particular user. Is that right?
That is absolutely right. So through IPlum, we have provided additional, it's called a business contacts. So it's a separate phone book which which is siloed within the IPlum app. It is not exposed to the personal phone. And this is where you can save your business contacts and related information. And through the encryption process, it is encrypted on the back end of the server. So you can retrieve it. Let's say you lose the phone and you install IPlum app on a new phone, you can retrieve the data back from it. And it's secured and backed up. So it can be archived, back to the phone. And the back end, it's done with we call it symmetric encryption. So there are three levels of encryption. There's an encryption on the device itself. Then there's encryption between the data flow from the device to our servers. We call it PKI encryption, public key interface encryption. And then within the servers, when it's flowing from one server to another server on the cloud, we use symmetric encryption. So that's another level of encryption being used. So it's highly protected data. And you're right, on the business contacts, we have done it so that the providers can maintain a separate phone book for business contacts and not mix up with their personal contacts.
Yeah, and one of the big challenges for providers, like say a solo practitioner, when they use their own personal phone line, is now they're getting calls and text messages from clients when they're off hours. So they're just trying to enjoy their time with their family and they're, being interrupted. So being able to set your on-call and off-call hours where things will roll into voicemail and you won't be interrupted off hours is really helpful. So I know, IPlum has that functionality. Does IPlum have the ability for ring groups where if someone doesn't pick up a call, where it could be passed over to another user, another staff member?
So the way it's done is we have different features. It's called sequential ringing. Now, it's not exactly based on the ring groups, but it's more we have actually a whole new feature called auto attendant and extensions, and it's extensively used by providers which have more than one physician. So they use IPlum like a full-blown cloud phone system where the call comes in, they'll do an auto attendant greeting. Thank you for calling our healthcare company. Press 1 for making new appointments, press 2 for reaching Susie, etc. Right? So there you can set up extensions, and these extensions can be set up with, we call it sequential flow. So it first rings the first person if that person is busy or they are offline. It can ring to the second person. And second person can pick up the call. If again not, then go third and so on. And we also have what's called simultaneous ringing. So if you have multiple providers and you want whichever is available to pass the call to them, the system can do that as well. So that's another feature.
Yeah. So can IPlum be used as a call center?
It can be used as a business. We call it phone system. We don't really go with a call center. The call center has a different terminology and different requirements. But IPlum is actually used by healthcare providers, which can have up to 200 lines because they have so many employees. So they can manage their entire sort of workforce, all their sales, all their customer service, extensions to each individual clinician separately. All that can be managed using an auto attendant feature. And the nice thing is there's no separate cost for it. So auto attendant is included in your IVR. Every client who gets an IPlum subscription has an auto attendant included in it. It's just that they go in and they configure it. They can configure the phone system, they can configure the extensions and the system. And it's a very powerful tool to manage the entire, we call it, small office.
Excellent. Yeah. And another important consideration when looking at onboarding a new technology is the sustainability and updates of the technology. So is the company going to be around, and are they continuing to look at upgrading the technology? Can you speak to that? Like updates that you see coming up and the sustainability of the company?
Absolutely. So we have been almost 6 years into existence, and IPlum is rapidly growing. We have clients who are based in US, but there are a lot of clients in Canada and overseas as well, which use IPlum for their day-to-day management, like business line. So IPlum has a big client base, and we are constantly evolving. If you look at the feature sets, we have added so many features in the last 12 months while everyone was sheltered down the COVID. And there are constant updates happening. For example, on the iOS app, we are on the 7.1.8 version. And almost every month there's a new release. The new release has either new feature updates or some fix for existing features, or iPhone changed some security pattern, or Google Play changed something. So on the Android side, so you're constantly evolving. And the thing we can do that is because of the feedback from our clients. So we listen to them, and based on their feedback, they are our sort of called product division. Our clients, they talk to us, they tell us what they want, and we develop a new feature set based on their requirement. So really, it's a like we create a new product, we get a feedback, and they tell us what new features they like, what they don't like, what they like, and based on that, that's our next roadmap. So we don't have to think anything. It all comes from your clients, from all the good clients we have. We love them, and hopefully we can keep delivering it. But this company is doing really well. We give a low product, but we are profitable, so it's a long term, and we plan to build on top of this. There are more features coming in the healthcare sector. We are internally developing video solutions as well, so we can provide telehealth, video solutions for our providers. So features we are working on is to extend this product and make it better and better going forward.
Excellent, fantastic, yeah. So if you are needing a phone service, texting, fax, I highly encourage you to take a look at IPlum. And for a visual, here's their website. Here's some images that they have on how this works, where you can set your hours. You have the auto text reply, which is really helpful for healthcare. The call recording talks about their security and how it is that IPlum allows you to remain HIPAA compliant when using it. So yeah, I really appreciate your time today, Pankaj, for walking us through this. And we also have a coupon code for IPlum, which will be in the description, which can save you on your subscription to IPlum. Thanks a lot.
Thank you very much, Ray, for having me.